Good evening and welcome to our COVID-19 update. I am Ladi Akiriduluale. Here are the highlights at this hour. Federal government to spend almost 9 billion naira on the procurement of COVID-19 test kits. Kano residents continue to ignore COVID-19 protocols on wearing of face masks as Governor Abdullahi Ganduje orders the arrest of defaulters. Let's start off with the news that the Federal Executive Council has approved the sum of 8.49 billion naira for the Nigeria Center for Disease Control, NCDC, to buy different requirements to enable the agency ramp up testing for COVID-19 in the country. Speaking to State House correspondents after the 11th virtual Federal Executive Council meeting at the State House in Abuja, Health Minister Dr. Osage Ehanire says the materials will help expand testing and diagnostic capabilities as the country battles community transmission of the disease. Other members presented to the council include those on the impact of security on mines and steel development, as well as a national gender action plan on climate change.
President Muhammadu Buhari presides over the 11th virtual Federal Executive Council meeting at the State House in Abuja. The security situation in the country has been a front-burner issue for weeks now, with the president holding a series of meetings with governors and security heads on ways to mitigate the problem. This time, the Ministry of Mines and Steel Development is asking for help to tackle the banditry in the northwest, which has crippled mining activities there.
The Council directed that the National Security Advisor should set up a special unit domicile in the FCT, Abuja, to coordinate, and coordinated by the Office of the NSA to carry out targeted operations at identified and confirmed illegal mining sites.
Also discussed at Council is the need to mainstream gender within the Climate Change Action Plan, seeing as women bear the brunt of climate change.
We take particular interest to make sure that women are involved in climate action activities, right from the inception, design, development, implementation, monitoring and evaluation of projects.
Then, the Minister of Health speaks on Council's moves to fund the Nigeria Center for Disease Control to improve testing as Nigeria navigates community spread of COVID-19.
The cost is 8.949 billion. That is to procure the items that are involved. Procuring testing materials, right from sample materials to other kits for diagnostics in our laboratory systems to be able to respond properly to the community transmission phase.
The Edo governorship campaigns have drawn criticism across the country, with attendees, which include government officials, accused of not adhering to the COVID-19 guidelines. This situation was also addressed at Council.
People take their beacons from us here, and you people. So you can see that it's not just about those people that went to campaign in Edo. As a matter of fact, in some parts of the country, you think that anybody wearing a mask has COVID-19. But they don't believe it. So I think we all should take personal responsibility.
The plan is to have at least one sample collection center in all 774 local government areas in the country, which is vital at this point, as 586 local government areas are already impacted by the pandemic. Kayla Magwa, Channels Television News.
Meanwhile, the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sania Liu, is insisting that there is no scientific evidence to indicate that the use of disinfection tunnels are effective for the prevention of COVID-19. Speaking at a virtual colloquium organized by the Joint Admissions and Matriculations Board, JAM, Dr. Liu explains that already established non-pharmaceutical measures, including wearing of face masks, regular hand washing, the use of hand sanitizers, and physical distancing remain the safest ways to prevent the spread of the virus. Dr. Aliyu encourages Nigerians to pay more attention to personal hygiene and other safety protocols.
Coronaviruses, they are respiratory viruses. What are you trying to achieve? If you use a mask, you're preventing the virus from escaping. Contamination of fomite surfaces, if you wash your hands and you don't touch your face, you will not have transmission. But you don't carry COVID all over you all the time. If I pour disinfectant, it doesn't matter what I pour. It's no different. In fact, it will be less effective than washing my hands. Because as I walk in, I'm not walking in and going like this and removing my, no. I'm walking in a normal way. So there are only surfaces that the disinfectant may touch. But there are a lot of surfaces that the disinfectant will not even touch. The tunnels, it's not like as you go in, they ask you to open your mouth, and then nose, and then eyes, remove your glasses, etc. It isn't. Certainly from our perspective, the PTA perspective, the evidence is just not there. And the problem with doing interventions that do not have evidence is it gives a false sense of security that you are doing something right. It was the same argument we had when we had a mask, because the other side was saying, look, if you wear a mask and you don't do it properly, your eyes are exposed, maybe you not wash your hands, you'll be touching your mask all the time, so touching your face all the time. So instead of protecting yourself, you could end up actually harming yourself. And in fact, WHO have a recommendation as well, if you look at their website with regards to disinfectant.
National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu. Over in Yobe State, the government has asked civil servants on grade levels 01 to 12 in the state to resume work on Monday, August the 17th, 2020, as well as asking them to wear masks in offices and other public spaces. The chairman of the Committee on COVID-19 in the state, who is also the deputy governor, Idi Barde Gabuna, made this known while briefing journalists at the end of its 15th meeting at Government House in Damaturu. While commending donor and implementing partners for support, the committee stressed that observing safety protocols remain the main prevention and control methods against COVID-19. Yobe State has so far conducted 362 COVID-19 tests with 67 confirmed cases, 8 deaths, while 59 patients have been discharged.
Civil servants on the level 1 to 12 are hereby directed to resume normal working hours with effect from Monday, August 17, 2020. Heads of MDS are directed to put in place and ensure full observance of COVID-19 protocols. Citizens are reminded that wearing of face masks in all public places is mandatory and should be strictly observed. Banks, markets, and other private organizations should ensure social distancing in their office as well as observe other COVID-19 protocols.
The National Association of Nigerian Students, NANS, in Ebonyi State, has asked the federal government to expedite action for schools to reopen soon. Its Director of Special Duties for the South-South and Southeast, Nworoku Olisa, says it is pertinent for the federal government to resolve all issues relating to the closure of schools, as they are not downplaying the possibility of spread of this pandemic if schools are opened. They stress that all other institutions in the world have modalities put in place to hinder just such a spread.
We are worried about the damning social events, evils, which have taken advantage of the idleness of Nigerian students. Evils like prostitution, rape, and sexual immorality, and even robbery, resulting in the deaths of our students. We are worried that if not curtailed on time, it will mature to full insecurity in places that have been relatively peaceful. Our students may degenerate into destructive elements, threatening national peace, giving their energy, time, and youthful exuberance. Their continuous stay at home is a recipe for disaster that may be worse than the pandemic that have precipitated it. We are also worried about the depressing consequences which the unending nature of the lockdown of schools has brought. It's like putting our future on lockdown, our hopes and aspirations on lockdown, and the worst thing to lose is hope. Shared by the decision of the government, especially the decision to open religion activities, political activities, and economic activities, except educational activities, we have resolved, therefore, condemn in strongest terms the prolonged subsisting ASU national strike, which Nigerian students have long faced before the intrusion of this COVID-19 pandemic. The nature of the strike is such that it would surface again if the ban of academic activity is lifted. We therefore call on the resumption of negotiation between the federal government and ASU. You are essentially negotiating our future. What is on the table is our future, and we demand that both parties approach this with the sense of responsibility and agency that it deserves, and not see it as a power play.
From Ebonyi to Imo, where the Nigerian Medical Association there has been speaking on issues faced by its members in the fight against COVID-19, especially welfare. Our correspondent, Itokwe Kutei, has more.
According to the NCDC, the confirmed cases of coronavirus disease in Imo State as at today has risen to 485, with 314 active cases, including patients at the isolation center. Medical workers at the forefront of the fight against the pandemic in Imo State are concerned about some issues they face in the course of discharging their duties. At a press conference in Owerri, the Imo State capital, after the annual general meeting of the NMA in Imo State, the chairman of the association, Okwara Chidebere, said the association is demanding full payment of a special COVID-19 hazard allowance to doctors working at the isolation centers and other relevant unpaid entitlements accrued to the doctors.
We have also demanded that special COVID allowance also be paid for those people that are in the COVID isolation centers in the state. That we also request that the state government review the current hazard allowance being paid to doctors and other health workers and consider an upward review of this. The AGM observed that promotion arrears of May 2018 to date are yet to be paid to doctors in the Health Management Board and Imo State Specialist Hospital.
What we are saying is that COVID-19 did not start today, and services rendered for patients did not start today. There are people that have worked in those centers, and there are people that are still screening people, collecting samples, and those people have not been paid. So what we are saying is that those people that have rendered services from the beginning, from the time COVID-19 was first diagnosed in Imo State, till date, they should have some sort of remuneration. They should have some sort of hazard allowance paid to them.
Nationally, we have lost some of our colleagues. A lot of people have come down with this problem. They need to be compensated. Something needs to be given to them.
Even though the compliance level to the COVID-19 protocols in Imo State is not impressive, the state government has continued to appeal to indigents to take seriously these precautionary measures to contain the spread of the virus in the state. From Owerri, the Imo State capital, Itokwe Kutei for COVID-19 update.
We return to the north, but this time in Katsina State, where the government has said that it has taken effective measures towards curtailing the spread of COVID-19 in affected local government areas. This is going by the desired results and objectives being achieved in the fight. Governor Aminu Masari was speaking today at the Katsina Central Store, where he flagged off the distribution of palliatives to residents.
Emergence of COVID-19 pandemic in Nigeria has no doubt witnessed an unprecedented solidarity and cooperation amongst levels of government and individuals. In Katsina, Nigeria's northwest region, Governor Aminu Masari leads members of the state executive and other dignitaries to flag off the distribution of palliatives to residents. The governor takes the moment to announce that his government has taken effective measures towards curtailing the spread of the coronavirus in the affected local government areas.
The virus has, without any distinction, affected most strata of the society. In our efforts to combat the pandemic, however, the state government has taken effective measures in the affected local government areas and has yielded the required results for curtailing the spread of the pandemic.
The state deputy governor, who also doubles as the chairman of the state COVID-19 Emergency and Preparedness Response Committee, gives an account of all donations received by his team.
The government has so far received a total of 428,311 out of the 469,742 assorted food items donated to the state by our government. We are assured that outstanding will be delivered within the next 2 weeks.
A total of 67,106 most vulnerable households have been selected to benefit from the palliatives meant to cushion the effect and hardship facing most families in the state.
The palliatives, there is rice that will go to each household, 10 kg, one bag. Pasta of 20 pieces, 2 carton. Noodles of 40, 1 carton. Sugar 5 kg, 1 bag, 1 small bag, 5 kg. Salt 1 kg. Gari stroke samo 10 kg. Maize or masa is also 10 kg per household.
Data from authorities show that the state has a total of 6,908 suspected cases so far, out of which 746 are tested positive to the virus, with 24 deaths recorded and 705 patients already discharged.
Most youth in Nigeria may be limited in knowledge or certain experiences by age, and some of them have been airing their views about the strange and novel COVID-19 pandemic. Some young minds on the sidelines of the International Youth Day Forum in Ado-Ekiti, the Ekiti state capital, have been talking about what they feel about the pandemic and the lessons that they have learned along the way. Babajide Agbeyo brings us the update.
COVID-19 pandemic is a new experience the world over, and the young ones are definitely witnessing this or the semblance for the first time. Marking the World International Youth Day in a pandemic year is definitely an experience which the youth say will become an indelible part of global history.
2020 happens to be one of the years that people have been willing to see, people have been so eager to see, but it's quite unfortunate that the way it actually came, so painful, and it is globally. It is not what someone can just handle. It goes beyond everyone's expectation, but notwithstanding, it is just a story to tell.
But the youths see the pandemic as a temporary encumbrance and a catalyst for change and innovations.
Now is the time for everybody to equip themselves, look outside, white collar job, instead of constituting more problems to the society. Let's be a solution. So that is what I've been doing now, and looking at other opportunities. Okay, if I'm not employed by somebody, I can actually employ somebody. So how do I do this? These are the things that I'm doing now, and I think it's one of the way out of this pandemic.
The COVID-19 experience is historic and unprecedented, and it has triggered increased awareness and added knowledge. Babajide Agbeyo for COVID-19 update.
Take a break. When we come back, we'll get a very unique perspective on the issue of compliance and enforcement of COVID-19 protocols. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. A total of 263 COVID-19 patients received a clean bill of health in the last 24 hours, while 6 lost their lives to the COVID-19 virus. According to the latest figures from the Nigeria Center for Disease Control, the NCDC, the nation has recorded 47,290 positive cases of COVID-19 from 319,851 tests conducted since the inception of the pandemic in late February. 33,609 patients have so far been discharged, with 956 fatalities. As at the last count, more than 12,000 individuals still have the virus, according to the NCDC. A breakdown of the latest figures showed 21 states and the Federal Capital Territory account for 423 new cases. Lagos with 117, the FCT follows with 40, Ondo has 35, Rivers 28, Osun 24, Benue 21, Abia and Ogun 19 each, Ebonyi 18, Delta and Kwara 17 apiece, Kaduna 15, Anambra 14, Ekiti 11, Kano 9, Imo 6, Gombe 4, Oyo and Taraba 3 each, Bauchi, Edo and Nasarawa all have 1 each. Face mask use used to be a thing seen in theaters or hospitals or emergency healthcare practices. However, following the outbreak of COVID-19, the use of face masks to keep people safe from the disease has become a trend on people's faces. Nigerians started sewing their own face masks. Vendors are seen everywhere with different shades and colors. The government, in its bid to curtail the spread of COVID-19, also shared its own face masks. But recently, more people are seen without the masks as the number of cases have begun to drop. But the president, Muhammadu Buhari, has directed that everyone must put on a face mask in public.
All your passengers must use them.
The Kano State Governor, Abdullahi Ganduje, is unhappy with the increasing number of COVID-19 cases in the state. He gives basic directives on adherence to safety protocols, especially the use of face masks.
And any member who is found in your vehicle without using the face mask, it is your fault, because you are not supposed to take any passenger who does not agree to wear the face mask.
Shortly after, Kano residents are seen going about their normal businesses without the use of face masks, leaving just a few complying with the directive.
As the federal government has exhausted that we have to put face mask on our face, and then due to the situation we are now,
others feel they need to stay safe.
I wear this mask because I use it to protect myself because of there is communicable disease that can affect human being now, like coronavirus and some other diseases.
The call for the government to enforce these safety measures, however, falls on sensitization of all concerned.
If the government can look over it and then sanitize the people well, and if there is possible need, they should enforce it to others for the people to be wearing the face mask here in Kano.
Wearing a face mask to prevent the spread of COVID-19 is vital, as this is one of the simplest ways of curtailing the disease.
Some cheery news in the fight against COVID-19. The Minister of Foreign Affairs, Jeffrey Onyema, has recovered from COVID-19 a few weeks after testing positive to the virus. The minister, who announced this on his Twitter handle today, says he spent 3 weeks in isolation. The tweet reads, "By the very special grace of God, my latest COVID-19 test result came back negative after 3 weeks isolation. I'm eternally grateful to my family, the CNC and VP, the medical team, relations, friends, colleagues, religious leaders, and numerous well-wishers who, through their care, prayers, fasting, messages of support and encouragement, never let me walk alone." The minister, who, as you already saw there, has resumed duties, was welcomed to a round of cheers by staff of his ministry. All right, let's expand the scope of the discussion about enforcement as promised before the break. And we go to Ado-Ekiti, the Ekiti state capital, where we're joined by the chairman of the Nigerian Governors Forum and governor of Ekiti State, Dr. Kayode Fayemi. Dr. Fayemi, thank you for your time and welcome to the program.
Thank you for having me, Ladi.
Congratulations. You are also a survivor of COVID-19. Just before coming to you now, we saw the return of Mr. Onyema, the Minister of Foreign Affairs. What was the experience like for you with COVID-19?
Well, I'm glad that my brother Jeffrey Onyema is out. I spoke to him earlier in the day myself because we were both monitoring each other since our period in confinement literally coincided. Well, my experience was rather shocking to me. I not that I didn't believe that the COVID-19 problem is real. I've been campaigning in Ekiti. I've been at the forefront telling our people that we need to take it seriously. I couldn't even put my finger on where I contracted the virus, but it knocked me out, and it started with a bout of almost permanent headache, and eventually led to delirium, some hallucination, and almost borderline depression, which you could associate with my isolation and perhaps the drugs I was taking. But I was also fortunate that there were really no serious symptoms for me. such as has been experienced by other people. I never had to go on any ventilator. My oxygen level did not go below 90, and my temperature that went up in the initial days came back to normal and oscillated between 36.8 and 37.2. But the psychological impact of COVID-19 is something that we haven't been talking much about. And I think that's the area that, in addition to the treatment plan, I think many of the patients, many of the survivors that I've interacted with also experience what I experienced in terms of the psychological impact. And we may need to also use the services of clinical psychologists and psychiatrists in managing COVID-19 patients, because I think it affects the central nervous system, and this also has its deleterious effect on the psychological state of those who contracted the disease.
Now, from there, I want to take up the issue of enforcement and compliance, because in your answer now, you talked about the fact that you'd been campaigning for this. It's almost 6 months now since COVID-19 first made its appearance in Nigeria. To be precise, it came in February 27th. And since then, there's been enlightenment, awareness, and so on. But last week, through the Presidential Task Force on COVID-19, President Buhari gave a directive and asked state governors to implement the wearing. He was very particular about the wearing of face masks in their individual subnational levels, that's at the state levels. As chairman of the Nigerian Governors Forum, what are the governors doing about that? Because as we've seen from many states, compliance is almost non-existent.
Well, yes, I had Mr. President give that indication that people were not complying with the mask. But if you would recall that, as a matter of fact, it was the Nigerian Governors Forum that first proposed the wearing of masks to the Presidential Task Force, and they embraced it. They agreed with us that it was an important step to take, and I know for a fact that in virtually all our states, the wearing of masks has become compulsory. I know that we've prosecuted a number of people for non-wearing of masks in Ekiti, for example, and I know that we've also made available masks that we have produced ourselves to citizens of the state, including students who just returned to school a few days ago. So I think states are aware of the necessity for masks, and they've been promoting and campaigning for this to happen. And they've also been working on compliance. I can tell you that at every meeting of the Nigerian Governors Forum, we reiterate these points: wearing of masks, lockdown of boundaries, raising awareness with our population, ensuring that social distancing is enforced and people do not gather beyond 20. All of these are contained in our protocols at the level of the states. And I believe if there's been ineffective compliance in certain areas, well, our duty is to continue to insist that this should be enforced, and we will do that.
The other, of course, I'm happy you mentioned the fact that it's quite possible that there has been non-compliance. Only last week, going into this week, there were several incidents in different parts of the country where, yet again, the protocols were not observed. People were not wearing face masks. What you pointed out about people not being more than 20 at an event, there were some events at which there were hundreds, possibly thousands of people, and many of them not wearing any kind of masks that took place. And the PTF put the blame squarely on the governors for this, because they said it's at subnational level that implementation is supposed to take place. I guess the question is this, Governor Fayemi, is there an agreed plan by the governors to ensure compliance? Because all the medical personnel we've spoken to insist that this issue of face masks is critical, but people are not complying. People are not complying with it.
There is an agreed plan, Ladi, and I believe that state governments are adhering to the agreed plan that we have at the Nigerian Governors Forum. However, I do not think we should leave out the place of personal responsibility. Where is the personal responsibility of our citizens to protect themselves? Yes, we are responsible for public health protection of all of our citizens, but our people who are of an age to understand the enormity of the challenge that this constitutes also do have a responsibility to take their own health seriously. Part of the problem we have is that we have a population in which people believe that COVID-19 is an elite virus, which does not really affect the masses of our people, instead of acknowledging the fact that this is a virus that is no respecter of anyone, rich, poor, young or old. We have evidence, and doctors have consistently made it clear to us that it has affected people in all age range, and everyone should be encouraged to take personal responsibility. In addition to whatever we may do, in Ekiti, we prosecute people for not wearing masks. But I also know that not all of our people are happy that we do that, but we just feel that we have a duty, indeed a responsibility, as the elected authority in this state to protect our people. And we take mask wearing very seriously. But even here where we take it serious, I cannot put my hand on my chest and tell you that if I walk into villages, I would not find people who do not take mask wearing serious. The reality is that government cannot be everywhere, but we do try our best to ensure that people adhere to the protocol that we have put out there for them.
I want to ask you also about the issue of funding and finance. Many of your colleagues in the Governors Forum have asked the federal government to facilitate some kind of funding to help cushion the effects of COVID-19 and to help with the process of continuing the containment strategy for COVID-19. It was in most of the media that the World Bank has made available about $114 million, and the story is that that money is specifically meant as grants to states. What's the plan for the use of that money with regards to COVID-19?
Okay, thank you very much, Yori. For us to succeed in the management and containment of COVID-19, we need a national strategy. We do not need a federal government strategy and sub-national strategy. We need a coordinated national strategy to deal with this. It is not completely correct that the World Bank has given states $114 million. What you may have read in the newspapers is that the board of the World Bank has approved $114 million, most of which will go to states to help them with the management and containment of COVID-19. However, it takes a little bit of time between approval of the board and disbursement to the states concerned, which will probably still go through the National Center for Disease Control, which is the vehicle through which the World Bank has been engaging with us, even though we also have our own direct engagement with the World Bank. So clearly, we commend the World Bank for that, and we're still awaiting that support. But let me add that what has happened to date is that World Bank, through the NCDC, has made available 100 million naira support to each of our states. But not all the states have accessed this fund. Only 16 states have done so within the Nigerian Governors Forum. Others eventually would access the fund, and this would help with the incident action plan that every single state has developed as their plan to manage COVID-19. But as you can see, the number is increasing every day. We now have 14,000 and almost 1,000 deaths. So states do not even have a sense of where this is going to end, when the vaccine will come, when we can be free from COVID-19 virus infection. And that is the challenge. There is no clear line of sight that we can say this is the destination and this is where it's going to stop and this is the amount that we need. And we keep spending money every day in the state, money that we did not budget for at the beginning of this year. And you would have noticed that almost every state has had to put in place a supplementary budget for their state in light of what COVID-19 has done in disrupting the budget that was put in place in January by every state. But that's the reality we're dealing with. We also must look at opportunities in this adversity and reorder our priorities and ensure that states run in an effective and efficient manner. If COVID-19 is what will make us do that, improve our health infrastructures, support our personnel, then so be it. We should take advantage of this challenge.
Thank you very much, Governor Kayode Fayemi, Chairman, Governors Forum, Nigerian Governors Forum, and Governor of Ekiti. Thank you for your time on the program, and have a good evening, and continue to stay safe.
Thank you, Ladi. Continue to stay safe, too.
The COVID-19 task force in Bayelsa State says it believes it has successfully flattened the curve regarding the COVID-19 virus in the state, as the number of active cases has reduced to 14. Let's get more from our correspondent, Dobra Timiwood.
There's an ongoing debate regarding the drastic number of active cases for coronavirus in Bayelsa State. Some people are of the opinion that the COVID-19 task force in the state are not testing enough people daily, hence the numbers are reduced. We spoke with the head of public health in Bayelsa State, and he says, no, they are testing enough people, but they believe that Bayelsa State has successfully flattened the curve regarding the coronavirus.
We have a target, a weekly target of the number of samples we had planned to collect every week. That target is 1,500 every week. But we have not been able to do 1,500. We do close to 1,000 samples every week. Those are a number of samples we collect from all over across the state. And presently, we do what we call institutional testing. We move from workplace to institutions, to places of work, to schools, to do testing. That's what we do. And we're able to do up to 1,000 tests, sample collection every week. So we have not relented at all in our sample collection. The reason why our results seems to be going down is because the results we report are mainly the positive cases. We don't report negative cases, and if we're not getting positive, definitely we're not going to report them. So what it means is that we've had a very good hang on our response, and we've done very well. And we have actually flattened the curve in Bayelsa State. That's what it means. So kudos should be given to the Bayelsa State government and to all of the people who have been in the forefront of this COVID-19 response, especially the healthcare workers, as well as the MDs and the CMDs of the tertiary institutions where we have isolation facilities, as well as all the volunteers and healthcare workers who have worked in the Public Health Emergency Operations Center all through these very difficult times. We must give them a lot of kudos. Rather than finding fault, rather than trying to say why our results are low now, we should begin to know that, it is the result and fruit of all the hard work we have done since the beginning of this response, from all the big public health measures His Excellency the Governor put in place to all of the other measures, both pharmaceutical and non-pharmaceutical measures we have put in the state that has brought us to where we are. And we are doing perfectly well with our response.
There are 14 active cases for the coronavirus in Bayelsa State out of the 346 confirmed cases for the state. 311 persons have already been discharged and the state has experienced 21 deaths. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Thank you, Dobra. Joining us now from Coventry in the United Kingdom is Dr. Osemeke Osokogu, who is a public health physician and the lead COVID-19 Alliance International Society for Pharmacoepidemiology. Quite a mouthful. Thank you for joining us on the program this evening.
Thank you for having me.
We're discussing the issue of enforcement and compliance with protocols. And just before you came on, I was talking to the chairman of the Nigerian Governors Forum. You are coming to us from the UK, where there is a high level of enforcement of the wearing of face masks, especially in public places. How is that working out?
I think a lot has to do with the level of awareness of UK citizens. So two things. One, the seriousness of the government, and two, the level of awareness of ordinary citizens. Because people on their own do quite a lot of work in monitoring how the situation is evolving, they do not need that much prompting to abide by the rules.
Over here, we hear that awareness is supposed to come before that. What lesson, what specific lesson, knowing our situation here, do you think we can take from the UK example?
I would say that considering our peculiar situation in Nigeria, we wouldn't have to leave it to the government alone. Yes, the federal government is there, of course, the state government and the local government. However, other non-governmental organizations and agencies can step in and better sensitize, especially those in the rural settings, but not leaving out even those in the urban settings, so that they can take this more seriously.
Looking ahead, though, let's zero in now on the UK's peculiar circumstances. For the third time this week, more than 1,000 cases have been reported. Is that a new spike, or is that the continuation of the previous spike?
I will look at this from this perspective. At a point, the government relaxed or eased the lockdown measures, and in fact, persons started going on holidays. There is the likelihood that specific steps taken by ordinary people because of easing of the lockdown measures has led to the new spikes. And in fact, I've been reading very recently and been in touch with persons that know that, such that the government may be thinking about reintroducing a few measures to further, restrict people's movements in a sense.
There was the fear, it continues to be a fear anyway, that just as the economy goes into recession and so on, and then there's this spike on the other hand, so there's funding challenge, and at the same time, there are overstretched and overworked NHS personnel, that there might be a problem. Do you see that happening?
My experience in the UK and in other places will rather make me understand that many of the problems that can possibly come up would have been seen well ahead and contingency measures put in place. I doubt that it will ever get to the point where there is some sort of major breakdown in the system, whether health or economy or otherwise. Of course, they are all linked, but I think there are good enough measures in place to forestall a major catastrophe.
Indeed. Dr. Osemeke Osokogu, thank you so much for joining us this evening on our COVID-19 update. It was a pleasure to have you.
Thank you for having me.
Art rather than ostentation is the rationale behind the world's most expensive COVID-19 mask, says the Israeli jeweler who is crafting the $1.5 million object for an unnamed US-based client. Made out of 18-karat gold and studded with 3,600 black and white diamonds, the mask will be fitted with an N99 filter to offer a high level of protection, so says Isaac Levy, owner of the Yvel jewelry brand. He says the client is a Chinese art collector living in the United States. The mask, which a team of around 25 artisans are working on, might be viewed a vulgar display of wealth during hard economic times, but for the creator, it is above all a work of art.
But it's more than just a mask. It is really a collector's item. Our customer happens to be one of the biggest art collectors in the world. It is a mask like any other mask, even more protective, just a little bit heavier and a little bit more expensive. We're very proud to be able to create such a mask that provides so much work to so many people that desperately need these jobs in these challenging times.
To think that that mask might not actually ever get worn. But to some grim news, the United Kingdom has officially entered into recession as the coronavirus crisis causes the economy to contract by a record 20.4% between April and June. The Office for National Statistics says it is the first time a recession has been declared in the country since the financial crash of 2008. Chancellor Rishi Sunak warns there are hard times ahead as the record-breaking contraction in the second quarter follows a 2.2% fall in the previous 3 months. Meanwhile, the number of COVID-19 cases in the U.S. state of Texas has exceeded 500,000, having reported more than 8,900 new virus cases on Tuesday.
Mask wearing is still a controversial issue for people in the United States, where many do not believe they need to. And as nationwide figures of COVID-19 rise, nearly 180,000 new child cases of COVID-19 have been reported in 4 weeks in the country, an increase of 90%. Meanwhile, European countries are battling growing outbreaks of the coronavirus, with Germany recording its biggest daily increase in infections for more than 3 months. In the last 24 hours, 1,226 cases were recorded, the highest number since early May. The health minister says he's concerned, but insists the situation remains manageable for now. Warnings have hardened in France over rising COVID-19 figure. The Prime Minister, Jean Castex, says the situation is going in the wrong direction and warns the epidemic could become harder to control. New cases have risen from a few hundred per day last month to an average of 1,600 now. The number of new clusters each day has risen fivefold. Finally, Australia today recorded its deadliest day of the coronavirus pandemic and the biggest daily rise in infections in 3 days, denting hopes that a second wave gripping the state of Victoria may be stabilising. Victoria reported 21 deaths, 2 more than the previous deadliest day earlier this week, and 410 new cases in the past 24 hours, ending a run of 3 consecutive days with new infections below 400.
That's our COVID-19 update for tonight. You can take a closer look at some of our figures in real time. Please visit our website, channelstv.com. There you will get updates and a better understanding of all you need to do to stay safe during this challenging times. There's also more on COVID-19 cases, the figures and numbers of recoveries in Nigeria, Africa, and indeed around the world. And of course, there are other stories, politics, business, and sports, amongst others. Do join us for a fresh set of packages on this program tomorrow from noon, and then at 6 and at 9. Thank you very much for watching. I'm Ladi Akere Doluale. Do have a good evening and stay safe.